From today on, we have entered into the next chapter of acupuncture treatment. First of all, we are about to discuss stroke, a very common disease in our acupuncture clinic. As for stroke, I think everyone is familiar with it. When studying TCM internal medicine, we knew something about this disease. As we all know, it is characterized by sudden coma, unconsciousness, deviated mouth and eyes, and hemiplegia. A slight patient may not report the process of coma, but only as deviated mouth and eyes, hemiplegia, and difficult speech. Stroke is very common in the elderly, but now its onset age gradually decreases, and there are many middle-aged cases. Winter and springs are the seasons with high incidence of stroke. Clinically, stroke can be recognized as a very common C critical disease. According to its manifestations, it is equivalent to the acute cerebrovascular disease in Western medicine, including ischemic stroke and hemorrhagic stroke. As for the etiology and pathogenesis of stroke, we have already introduced in the course of TCM internal medicine. Stroke is located on heart and brain and closely related to liver and kidney. Its pathological nature is root deficiency and branch excess. For its prevalence is among the middle and old age, we consider most of these patients are in constitution of Qi and blood deficiency. So we see that stroke is rooted on liver-kidney yin deficiency and Qi and blood deficiency, while its branch lies in the interaction of wind, fire, flame, Qi, and blood stasis, and the combination of root and branch eventually leads to the occurrence of stroke. Its basic pathogenesis can be summarized as the imbalance of yin and yang, the disorder of Qi and blood, the invading on the brain. For stroke, the slight type is meridian stroke, and the severe type is visceral stroke. As for the etiology and pathogenesis of stroke, let's simply review as this. Next, let's focus on the syndrome differentiation of stroke. By weather reporting mental confusion, we can divide stroke into two categories, meridian stroke and visceral stroke. Meanwhile, by the level of evil and vital Qi, visceral stroke can be divided into two categories, block pattern and collapse pattern. Moreover, block pattern, which was induced by excessive evil, is divided into yang block and yin block for its cold and heat nature. Therefore, syndrome differentiation should be conducted on these three levels. We just introduced the three levels of stroke. Firstly, we should differentiate meridian stroke and visceral stroke by weather reporting mental confusion, while for us majored in acupuncture and moxibustion, furthermore, we should define channel stroke, collateral stroke, zang stroke, and full stroke. It demonstrates the level of the stroke situation. Also severity. We should consider between channel stroke and collateral stroke which one is more severe. Basically, channel stroke is worse. Collaterals are reticulate small branches of meridian system, while channels are main streams. Thus, comparing to channel stroke, collateral stroke is lighter and located shallower. Both without coma, how can we differ channel stroke and collateral stroke? Collateral stroke manifests as only unilateral numbness, unilateral right mouth and eye, or limb weakness, without hemiplegia. On the other hand, channel stroke reports hemiplegia, deep limb numbness, and right mouth and eye. Therefore, comparing to collateral stroke, channel stroke is worse, located deeper, and along with hemiplegia. Collateral stroke may only complain about unilateral sensory disturbance. Secondly, between zang stroke and full stroke, which is worse? Zang stroke is more severe than full stroke. Down stroke and full stroke both contains mental confusion, but full stroke manifests as only temporary mental disturbance, no coma, while downstroke locates deeper, manifests as coma and unconscious. Therefore, on the basis of differing meridian stroke and visceral stroke by mental confusion, we can further differentiate channel stroke and collateral stroke by hemiplegia, also downstroke and full stroke by coma. After differing meridian stroke and visceral stroke, we should differentiate the second level. For visceral stroke, we should differentiate block pattern and collapse pattern, which means EVO blockage or vital qi collapse. So block pattern is excessive, collapse pattern is deficient. Then, what is a manifestation of EVO blockage? Coma induced by EVO blockage, along with mouth spasm, tightly collected hands, and closed teeth. These are all induced by EVO blockage. On the other hand, vital qi collapse manifests differently. The patient would be unconscious, the eyes are open, so is the mouth, with decreased muscle tension, limbs paralysis. Also, we can see incontinence on these patients. These are all manifestations of vital qi collapse. Thus, the second level is to differentiate block pattern and collapse pattern among visceral stroke. For the third level, among block pattern, we should differentiate cold type or heat type. According to its nature, we divide block pattern into yang block and yin block. Yang block is a heat syndrome, while yin block is cold. Yang block manifests as a series of heat phenomena, flame heat or flame fire, like red complexion, rough breath, scoring. Also, there may be obvious flame sound from the throat, with constipation, short urination. The tongue could be dry, with yellow greasy coating, even a shrink tongue, and the pulse could be wiry, slippery, and rapid. For patients with yin block, the manifestation suggests its cold nature. It could manifest as pale complexion, purple lips, and persistent phlegm and saliva. The limbs could be cold, with white greasy coating, deep slippery pulse. From the symptoms, we concluded that yang block is heat-natured and yin block cold-natured. As a conclusion, we emphasize the syndrome differentiation of stroke should be divided into these three levels. Firstly, by mental confusion, differentiate meridian stroke and visceral stroke. Next, by the level of EVO and vital qi, differentiate visceral stroke into block pattern and collapse pattern. Among EVO blocked pattern, yang block and yin block should be differed by its cold-heat nature. Only on the basis of correct syndrome differentiation, our formula or acupuncture treatments can achieve satisfactory effect.